Thank you. Good afternoon. I'm talking about clinical outcomes after implantation of a new long arc segment with 320 degrees in keratoconus patients. Well, we know that the main arc length segments used for keratoconus correction are the ones of 140, 160, and 210 arc length. And recently, we began to implant a new interstromal corneal ring segment with 320 degrees. As you can see here, it is almost a full ring. We conducted a multicentric study in 10 sites, eye clinics in Brazil, in which we studied 138 eyes of 130 patients, which were followed for an average of 6 months, with an average age of 27. And the surgical technique employed was manual technique in 45 eyes and the femtosecond laser assisted in 93 eyes. Results. Most eyes received a 200 micra or 250 micra ring segment. In most cases, most keratoconus cases were of oval type of keratoconus, followed by the nipple type of keratoconus. And here are the clinical outcomes. The uncorrected visual acuity improvement from 20 to 150 to 2060. The corrected visual acuity improved from 2060 to 2030. There is a significant reduction in the spherical equivalent, increase in pachymetry, and all evaluated parameters show the statistically significant improvement. As you can see here, the asphericity, corneal volume, there was reduction in the topographic astigmatism and significant corneal flattening. When you evaluate the keratometry variation according to the preoperative keratometry, we had as a result that the more advanced the case, the more the flattening effect. As you can see here, in patients with more than 60 diopters of keratometry, we had about 80 diopters of corneal flattening. And in less advanced case, you had less significant corneal flattening effect. When you evaluate the keratometry variation according to the keratoconus type, in all types, oval, nipple, or astigmatic, you had a significant corneal flattening and no difference among them. When you evaluate the topographic astigmatism variation according with the keratoconus type, the astigmatic type of keratoconus, patients with more astigmatism had more astigmatism reduction, and patients with less astigmatism, as the nipple type of keratoconus, has almost no change in corneal astigmatism. About the corrected distance visual acuity, at 3 months of follow-up, we had 71% of patients with vision better than 20/40, and after 6 months, there was an improvement. Almost 76% of patients had a vision of better than 20/40. About the corrected visual acuity lines, gain or loss of lines, 46% gained more than 2 lines of vision in 3 months. And after 6 months, there was an improvement in the line gain. 66% gained more than 2 lines of visual acuity. About the spherical equivalent, in 3 months and after 6 months, there was a continuous reduction of the spherical equivalent. Based on this study, the best candidates for these rings are patients with central keratoconus, hyperpolated corneas, low to moderate astigmatism, and visual acuity worse than 20/30. It acts as a new limbus because the flattening effect is all the same in the area inside the ring. So here, just to illustrate some cases, pre-op and post-op, another case, and a case with a suboptimal result. Here, as you can see, is a very asymmetric keratoconus, and you have an undesired flattening in this area of the yellow area. Another case of asymmetric keratoconus in flattening, undesired flattening here. So this is to show that it should not be being implanted in asymmetric keratoconus cases. Here's a good indication, an advanced case, a central keratoconus. Another good indication, central case, advanced keratoconus. Here a bad indication, asymmetric keratoconus, another bad indication, asymmetric keratoconus. In conclusion, this 320 new intradermal corneal ring segment can provide excellent visual, topographic, and refractive outcomes in keratoconus patients. As shown, there's a progressive effect of this segment. There is this of visual acuity and corneal flattening with time, and it should not be implanted in all cases of corneal ectasia. It should be reserved for advanced cases, and you should not implant in case of PMD, asymmetric keratoconus, and mild keratoconus. Thank you.